Start.
I'm Dr. Mohan Thomas, an American trained and triple boarded general cosmetic and facial plastic surgeon. I'm going to be talking about rhinoplasty. That is the topic. Why rhinoplasty? And what is rhinoplasty? Rhinoplasty, rhino meaning nose, and plasty means reshaping of the nose. Why are we talking about rhinoplasty? Because it is the most common procedure done worldwide. It is also the most commonly reoperated part of the body. And that brings us to this very important topic. What should you do? First of all, you need to have a good examination by an experienced and skilled rhinoplastic surgeon. The investigations may include a clinical examination as well as a CT or a CAT scan of the paranasal sinuses, primarily to find out if your septum is deviated. And why is that important? If the septum is deviated, the nose can have some asymmetries. To the right, to the left, the tip may not be right. Most common reasons why people are interested in rhinoplasty is because of why the nose is too wide, too long, twisted, asymmetric, tip is down. So all of these things can be corrected. Now, one of the most important things that a surgeon should be looking for is to see if the patient has something called BDD. What is BDD? BDD is body dysmorphic disorder. That means they're obsessed about their body part, in this case, the nose. My questions to them are number one, are you thinking about this nose all the time? If the answer is yes, that's the first red flag. Second question is, do you go to sleep? Are you thinking about your nose? And even when you wake up, that's red flag number three, if the answer is yes. Third question is, do you think after this rhinoplasty is done, your life is going to change, it's going to get better personally and professionally? If the answer is yes to that, that's the third red flag. Now, these are people that are obsessed. Obviously, there's no surgery for obsession. My suggestion would be to send them to a physiologist or a psychologist rather, and make sure that they don't have any underlying psychological issues such as BDD. Once you get an okay from the psychologist, then you can proceed. Now, it is very important that you understand what the patient wants. You cannot impose, I as a surgeon cannot impose my aesthetic values on the patient. Expectation management is the key to a successful outcome for any kind of surgery. So spend a lot of time making sure you understand, the surgeon understands you, and you understand the patient. The surgical procedure, by and large, is an outpatient procedure. That means you come in, you have it, then you go home. Generally speaking, the nose is packed for 2 days. This pack, which is a gel pack, comes off in 2 days' time, and then you're all set to go. You may have a small splint on your nose and some sutures here if it's done open. Rhinoplasties can also be done closed. Your surgeon will be the one that's telling you which is the best way to go forward. Now, what are the benefits? Obviously, the benefits are one, you can breathe better if there's a functional problem. The nose will start to look better. I don't change people's noses or faces. I make them a better version of them. We don't have catalogs. With page 69, you can choose, style number 42. There's no such thing. You must have an idea. A rhinoplastic surgeon or a good facial surgeon will know exactly what to do for you because they have a concept. And you have the blueprint in your head and you execute the procedure to make sure that it is what you should be getting. All right. Now, pictures are taken before and after. Some people do morphing. I do not do morphing because we cannot deliver what we do with morphing. A silhouette drawing or a pencil drawing, a side view, is a much better way to go. Now, unfortunately, what is happening these days is everybody around the corner is doing surgery. They think, what is in the nose? A small little thing like this. But the nose is a very difficult procedure to do. I have written extensively about rhinoplasty. I have a great deal of respect for it, even though I've done many of them and I'm comfortable with it. I do a lot of reoperates. In the last 10 years, I've done more reoperates than anybody else in this country. And the reason is people just walk into any office and they do you do a rhinoplasty? Sure, why not? And you have it done, and then the decision is based on what the fee for the procedure is. The most dangerous thing that you can do is to select a surgeon based on their fee. According to a survey done by the American Association of Plastic Surgeons, American Society of Cosmetic Surgeons, and even the facial plastic surgeons, the most common reason, the top reason why people have bad outcomes or unhappiness is because they chose a surgeon based on fees. So that's something you need to keep in mind. If need be, go for a second opinion. Ask for all the questions you need to. Usually, your downtime should not be more than a week or so, and the splint will come out. Everything comes off at the end of 1 week, and you obviously should be careful. Exercising, no exercising, with weights particularly for about 4 weeks. And try to avoid crowded places like a theater or a mall, which is air conditioned, because the same bugs float around. And so, if somebody walks in with a cold, you're going to catch it, and that's a bad thing to have. If you have allergies, please discuss with your surgeon so he can put you on antihistamine. When can you fly after this is done? Because most of my patients, a lot of them come from abroad, some of them come from all parts of the country. I put them on an antihistamine, take it 1 hour before you take the flight. Everything is going to be okay. There's no problem flying at all. Just make sure you don't get involved in any, aggressive contact sports and hurt your nose, and everything will work out for you. This is signing off. I'm Dr. Mohan Thomas. If you have any further questions, you can write to me, drmohanthomas@gmail.com. I hope you found this discussion useful, and all the very best to you.